A very good evening to all of you. Hope you are all preparing for your NEET PG exam with full energy. See, think every day that tomorrow is the exam. If you think like that, it will be very easy for you. And start practicing MCQs. Every day I am giving some 10 or 20 MCQs. Watch my other videos also, live videos. They will, it will be very beneficial for you. And please share this to your near students, to your friends who are preparing, struggling with the preparation. And I'm ready to prepare long videos also. If more number of people come live, then it will be more interactive. So kindly share the link. So this obstetrics and gynecology is a very, very important subject, as I have already told you. Clinical subjects, you should concentrate, no doubt. But equally important are the paraclinical and preclinical subjects. If you study them well, you will be able to answer the clinical questions also very well. So once you know so let us begin with the first question. In a young female of reproductive age with a regular menstrual cycle of 28 days, ovulation occurs obviously 14th day of period. When is the first polar body extruded? Now, without looking at the option, tell me what would be the correct answer. This should be a practice regularly. Immediately after reading the question, you should think of the correct option. Once this comes through practice, once you think of the correct option, then you will focus on the correct option only, and you will be able to mark the correct option correct. And so one is the first polar body extruded. Let us look at the options. 24 hour prior to ovulation, B. Accompanied by ovulation. C. 48 hours after ovulation. D. At the time of fertilization. Well, it is always accompanied by ovulation. So correct option here is B. Accompanied by ovulation. First polar body is extruded accompanied by the ovulation. Second polar body is extruded after fertilization of ovum by the sperm. The finding of a single umbilical artery on examination of umbilical cord after delivery is A. Insignificant. B. Occurs in 10% of newborns. C. An indicator of considerably increased incidence of major malformation of fetus. D. Equally common in newborn of diabetic and non-diabetic mothers. So the correct option here is an indicator of considerably increased incidence of major malformation of fetus. Let us look at what is the correct answer. It is C. The absence of one umbilical artery occurs in 0.7 to 0.8% of all umbilical cords of singletons. In case of singletons, it is 0.7 to 0.8% of all umbilical cords. In 2.5% of all abortuses. In an approximately 5% of at least one twin. The incidence of a single artery is significantly increased in newborn of diabetic method. It occurs in white infants twice as often in newborns of black women. The incidence of major malformations, that is the fetal malformation, when only one artery is identified, has been reported to be as high as 18%. And there is an increased incidence of overall fetal mortality. So correct option here is C. Which one of the following vaccination is absolutely contraindicated in pregnancy? Now, before looking at the options, tell me which vaccines are absolutely contraindicated in pregnancy. Are they live attenuated? Are they killed vaccines? Which one? Anybody, please comment in the chat box. Please comment in the chat box. Then only we will go forward to look at the options here. Please. So let us look at the options. A. Hepatitis B. B. Cholera. C. Rabies. D. MMR. This MMR vaccine is contraindicated in pregnancy. It is absolutely contraindicated. So correct option here is D. The vaccination which contain live bacteria or virus are contraindicated in pregnancy. Also, the administration of attenuated virus vaccines such as vaccine against measles, mumps, poliomyelitis, rubella, measles, mumps, rubella, poliomyelitis, yellow fever, and varicella are contraindicated during pregnancy. MMR is a live attenuated type and hence it is contraindicated. So the correct option here is D, MMR. Most common tumor to show metastasis to placenta. Metastasis to placenta is a rare event. It rarely occurs. So let us look at the options. A. CA breast. B. CA lung. C. Melanoma. D. No tumor can metastasize to placenta. In fact, some tumors may metastasize to placenta, and the most common among them is a melanoma. So the correct answer here is C. Melanoma. Malignant tumors rarely metastasize to placenta. Of those that do, melanoma accounts for nearly one-third of reported cases, and leukemias and lymphomas comprise another third. Oxygenated blood from placenta reaches the fetal heart in utero via A. Umbilical artery, B. Umbilical vein, C. Ductus venosus, D. Ductus arteriosus. Well, it is ductus venosus. So the correct answer here is C. Ductus venosus. Ductus venosus is closest to heart and it carries oxygenated blood, and therefore it is the answer for here. Let us move on to the next question. The uterine blood flow at term: A. 50 ml per minute, B. 100 to 150 ml, C. 300, 350 to 375, D. 570. Correct answer here is D. 500 to 750 ml per minute. This placenta serves as interface between the mother and fetus, allowing the exchange of physiologically important substances, including oxygen, carbon dioxide, waste products of metabolism, drugs, etc. Fetal blood travels from fetal heart to placenta by way of two umbilical arteries. If mother received mother received the treatment for bipolar disorder during pregnancy, fetus is likely to show. We all know it is abstinence anomaly, and abstinence anomaly is a cardiac defect. Let us look at the options. Excuse me. A. Neural tube defect. B. Facial defect. C. Urogenital defect. D. Cardiac defect. So the correct option here is D. Cardiac defect. In this way, if you practice the MCQs do come in the examination. We all practice theory and all those things. Reading theory is very good, but practicing MCQs is also. So please attend this live session every day, 7 p.m. Sometime the timing is changed, so don't worry about that. You will get intimation if you subscribe. So you can attend it live. You can see the recording again and again. It will be helpful. These questions will come in the examination. And if they come, you will mark them correct. So you are ahead, way ahead of competition if you practice these MCQs every single day. Don't think the exam is far away. Think the exam is very near. So you can click the link in the description box, join the rapid revision blueprint masterclass. It will be of 2 days. The actual fees is quite high, but it is free for my subscribers. But you have to click the link in the description box and join the WhatsApp group. There I will inform you about the timing. And you continue in that WhatsApp group so that whatever new videos I upload in other channels also or somewhere, I will giving link to those videos and some PDFs I will be preparing for rapid revision. It will be helpful for you. And you can directly WhatsApp me on the number. So 948,365,2020. So let us move on to the next question. This lithium is a category D drug. This lithium is known to cause various cardiac anomalies, especially Epstein anomaly. There is an increased risk of this anomaly in babies exposed to lithium during the teratogenic period as compared with the normal frequency of Epstein anomaly, which is about 1 in 20,000 births. So let's move on to the next question. Lactational amenorrhea is due to A. Prolactin suppressing GnRH, B. Prolactin increases FSH and LH, prolactin increases estrogen and progesterone, all of the above. Correct answer here is A. Prolactin suppressing GnRH. Emergency contraception prevents pregnancy by all of the following mechanisms, except. Read the question very carefully. A. Delaying inhibiting ovulation. B. Inhibiting fertilization. C. Preventing implantation. D. Interrupting an early pregnancy. So the except one is the interrupting an early pregnancy. It doesn't interrupt an early pregnancy. Emergency contraception is used to prevent the pregnancy after the act of unprotected intercourse. It is an interceptive. Its main action is to make the endometrium unsuitable for implantation. It may also prevent or delay ovulation. It may prevent fertilization of egg by the sperm. It has, however, no role in interruption of an early pregnancy once conceived. They are not abortifacients or contragestives. So the correct option here is D. IUCD having the longest lifespan is A. Progestasat, B. CUT380A, C. Mirena, D. Novati. Correct option here is B. CUT3A has a very long half-life, about 10 years. Then copper T200 is 3 years. Multilode CU350, 3 years. Multilode 375, 5 years. LNG IUS 5 years. Progestasat 1 year. Nova T 5 years. These half-lives are very important. Failure rate is also important. Contraceptives are very important. So practice as much as possible. Please like and share. One thing I want to tell you is that share this video with as many of your as friends possible. If you like this video, please share it. Sharing is caring. We are not competing. You people are not competing with each other. You have to compete with yourself. You have to be a better of yourself every day by practicing more MCQs, practicing more theory, making your concepts clear, reading regularly, practicing these things. Wishing you all the best.